Hello. Today will be talking with you regarding class 2 restoration. You can see I've drawn a proximal box. While doing a restoration, what we want? We want something like this. I'm talking about the contact. The contact should be rounded. As you can see in the premolar, how is the contact? It is slightly rounded. So again, what kind of contact do we want? Quite anatomical contact, and that is what? A bit rounded. However, what the problem we all are facing? Like I'll show you. In the earlier years, we used to use this Stoffelmeyer retainer and the band universal. However, restoring the contact with this has some problem, and the problem is getting the flat contact. As you can see, how the surface is absolutely flat. So when you are using it in a class 2 restoration, you are not going to get rounded contact. You are going to get what kind of? Flat contact, and flat contacts are not the anatomical contacts. So how we can get the exact anatomical contact? And the answer is sectional matrix system. You can see I have 3 sectional matrix system. The first one from TDV, the second one from Torn, and the third one is from top. Basically these two matrix system, can you see these two, the first and the second one, these two are basically used for restoring class 2, whereas this one, just see, it has a coin clip kind of a thing, and this is a sectional one. I'm just taking down the one. You can see it can be attached with this. There are holes in the sectional matrix, yeah, over here and over here. You can just apply it for restoring, but this is not used in routine class 2 restoration. This is normally used in post endo restoration, because the thickness of the matrix band, you can see sectional matrix is quite thick. It is normally used when you have done the root canal treatment and you want to do your post endo restoration with your composite or with your amalgam. You have one variant in this also. I'll show you. You can see, just see this. Can you see the extension? See the extension. This is normally used when you see the cavity is very deep. And here comes the concept of deep gingival marginal elevation. When you see the proximal box is very deep, almost you are approaching quite to the gums level, then these sectional matrix are very useful for marginal elevation. Normally these are used for post endo restoration. Now these two are basically the sectional matrix system. You can see there is 2 kinds of ring in the TDV. One is soft, this one pink one is soft, this one is hard, fine. And you can see these are the various sectional matrix I am holding. You can see I'm just holding. Can you see and compare the thickness between these two? This is very thin in comparison to this universal. The thickness is too much. Along with, you can see I was talking, getting the rounded contacts. You can see the concavity and see the convexity. You can see, you can clearly appreciate. Whereas if you restore with this, you're going to get what kind of contact? Rounded contact. Whereas when you're using this, you're going to get what kind of contact? Quite flat contacts. In this we have different kinds of, like when the cavity margins is quite deep, you can use this. You can compare between these two. You can see the extension. See the extension. Here you have no extension. When the cavity depth is too much, quite reaching the gums, you can use this one. This part will go just below the even with the gums level as well, fine. And this also I'm having from the Tom. Again, this is a ring, and these are the various sectional matrix. Both are good. I'll just apply it on the tryphodon, then you will able to see. I'm just taking out one of the sectional matrix. Yeah, I've just taken out. Now we can apply this. So see, it has gone. Fine. And then you can use the ring. Then you can apply. Just see how beautiful it is. Fine. And the other one I'll show you. You can apply this also. Just taken this ring. You can see there's a hole overhead to hold the matrix band. Just see how I am holding it with the help of the hole. You can again apply this. It is gone. Can you see? And then you can apply the ring. And you can just bend it on the occlusal surface of the adjacent tooth. Just see. Now you can restore the class 2 in both. However, if we compare between both are good, but this one from the Tom, it has one advantage. It can be used even when the class 2s are very big. Sometimes we encounter when the class 2 are too big, isthmus is too much, and there is mild separation between both the tooth. In that case, if we are using this one from the pink color from the TDV, what we can see after restoring, we can still see the slight amount of gap we can see. However, when we are using this, it do not apply pressure. So again, even with a slight gap is there, still it will able to close the gap. Fine. And you can apply the wedge also. We have two kinds of wedge. One is the normal wooden wedges, and the other one, the more recent one, you can see with the different color coding. These are the elastic wedges. You can just hold it on. I'll just show you. You can just stretch it. Just see, you can just stretch it. And this can be passed on. And when you just leave it, just see. Again, you can get that. The old one are like these. These are also good one, not the bad one, but these are comparatively a recent one. I'm going to apply it on the just adjacent so that you can compare. Right? You can compare the wedges. This one is elastic wedge and this one is a wooden wedge. Both are good, but these are comparatively a recent one. So if you're using these sectional matrix system, you're going to get very good class 2 contacts. Patient will not going to have any kind of problem like food lodgement, which is the most important complaint with the class 2 restoration. Fine. If you want to learn more about the class 2 restoration, want to practice class 2 restoration with me on the patient, then do come to the Ahead Dental Academy and we're going to teach you. Fine. So bye bye for now. Bye.